MAP was founded in 1954 with the simple idea of matching excess pharmaceutical resources in our country to health needs around the world. Specifically, our founder sought donations of quality medication and other health products from the U.S. pharmaceutical industry, and then provided them to a network of under-resourced mission hospitals, providing health care to people living in impoverished rural communities around the world. This was a win-win situation. From time to time, pharmaceutical companies overproduce or undersell quality, FDA-approved medication that still has an adequate shelf life before expiration. Rather than destroy these extras, companies may donate them to MAP, knowing these products are desperately needed in the places we work. At the same time, mission hospitals and the people they serve gain access to quality medicine and other supplies they could otherwise only dream of having. Over the years, MAP has turned this initiative into a multi-billion-dollar global program. In fact, we have recently passed the milestone of having provided medication and supplies valued at $4 billion globally through our history. Of course, medications aren't enough to ensure good health. Along the way, MAP developed community-based health education programs designed to prevent disease, train local health workers, provide clean water, improve sanitation and nutrition, as well as a variety of other activities. Today, we still stand on these two primary pillars. We provide medication because people are sick and need treatment, and then we address the root causes of why they are sick in the first place through our health-focused education and training programs. Besides these two main initiatives, we also developed a disaster response program to provide health services to people affected by natural and man-made disasters. Our primary objectives are built around a fairly simple strategy we call provide, prevent, promote. Provide essential medication, prevent disease, promote health development. You might look at this as 3 steps in the health continuum. First, people are sick and need medical treatment. Our contribution is to provide high-quality, essential medicine needed at hospitals, clinics, and refugee centers to treat illness and disease. Second, we want to prevent people from getting sick in the first place. So we offer health education and training programs to help families identify, detect, and avoid illnesses from malaria, tropical diseases, HIV/AIDS, and others. But it's not enough just to be disease-free. We are interested in seeing families live healthier lives. So lastly, we promote community health development by focusing on such things as clean water, improving nutrition, creating cleaner environments, producing income-generating plans, and others of the so-called social determinants of health, all those factors that impact whether a person can live a healthy life. More specifically, our current objectives are as follows. Expand our global health supply chain to provide more high-quality medication to our partners. This means going well beyond our traditional U.S.-based pharmaceutical sources to build a global capacity to acquire medicines from the best and lowest cost suppliers around the world. Also, target our disease prevention programs on what are officially called neglected tropical diseases, a group of diseases found only in the poorest communities worldwide that have been neglected because very few people in wealthy countries have heard of them. Lastly, promote health development in even more communities with a focus on the health and well-being of women and children, provide clean water, and expand our comprehensive village health model. Partnerships are what make MAP successful. We have a large global footprint, one we could never have developed on our own. One of the keys to our efficiency is that we get a lot done at a low cost because we leverage key partnerships. One evidence of this is that we continually receive the highest rankings from charity watchdogs. We are number 1 on Charity Navigator's ranking of the best large nonprofits. Here is an example. I was in Guatemala recently in a very remote village down a long, very bad road where the closest health facility was several hours away by foot. And yet, through a MAP program, pregnant women there were receiving high-quality prenatal vitamins to improve their health and the health of their babies, and reduce the likelihood of conditions like cleft palate, which is all too common there. How did these women get such great vitamins? We leveraged our partnership with a U.S. pharmaceutical company that donated the products to us. We leveraged our partnership with freight forwarders and shippers to move the products to Guatemala. We leveraged our partnership with a great local partner who could easily move the products through customs and get the vitamins safely to even remote villages. And then we leveraged our partnership with a dynamo of a local health worker who organizes maternal health campaigns in remote communities. We knit this network together, and the result is healthy moms and kids. That is effective, proactive leveraging. Year after year, we receive super clean audits from our hard-nosed external auditing firm. This is no easy task. The audit requirements on nonprofits have ramped up significantly over the past decade, and we have had to keep pace. I call this the tip of the iceberg. What I mean by that is that the clean audits are the result of incredible integrity from our most remote field project to our global distribution center, and from our handling of donor money to our basic financial processes. Basically, we do things right. We have a strong governing board. We implement the right policies. We hire the right staff. We champion honesty, openness, and integrity. A few years back, we received the first ever Standards Award from the largest association of nearly 200 U.S.-based global relief and development agencies. Getting this award from our peers, fellow members of the association, was another indication of our attention to doing things right. All that said, we make our share of mistakes. We certainly are not perfect, but we learn from them, improve, and keep going forward. We track a lot of things. Here are a couple of examples. Believe it or not, a common metric that shows health improvement in a poor rural community is the increased use of dish racks. Let me explain. Many common illnesses in poor communities are due to simple things like sanitation and cleanliness. For example, building latrines is a key strategy to reduce the incidence of diarrheal disease, which is still one of the biggest killers of kids under age 5. But even simpler things like learning to wash and correctly dry pots, pans, and dishes makes a big difference. Too often, these are not well cleaned and sometimes not cleaned at all and get contaminated by dirt and animals. These unclean conditions spread disease. One strategy MAP uses is to educate mothers about the importance of fully washing the dishes and utensils and building a raised drying rack to keep them away from the family's animals. To show changes in healthier behavior, we literally count the number of dish racks being used in an ongoing way by families that have been trained. Now that's just one small example, but it shows the level of detailed information we track on our projects. On another scale, our external auditors each year conduct a count of the inventory of medication and supplies in our global distribution center and compare it to what our inventory tracking software says should be there. Annually, the variance is something like 0.003%, which our auditors say is unheard of in this industry. That's amazing considering the hundreds of millions of dollars of products that flow through our distribution center each year. As I said, we track a lot of details. Charity Navigator, the respected nonprofit watchdog agency, ranked us number 1 in efficiency and effectiveness among large, complex charities with annual revenues of more than $100 million. They called this the Best Charities Everyone Has Heard Of list. The assumption was that since these charities had large budgets, they were well known. Well, that is not true with us. We are not well known. I often think of us as the best kept secret out there. This is not by design, it's just that we have not spent a lot of money over the years in marketing. We tend to put our resources where they do the most good, in the field, helping to improve the health and well-being of people struggling against poverty and disease. Ironically, it is in part because we don't spend a lot of money on marketing and other overhead that we get such high rankings for the way we use our resources. And those rankings get us on lists of the best charities, including the list of charities everyone must have heard of. MAP has pioneered the effective practice of delivering donated medicines and medical supplies to hospitals, clinics, and refugee centers globally to improve access to essential medication among the poor. We've also helped set standards for drug donations, including being a founding member of the Partnership for Quality Medical Donations. MAP reached an impressive milestone of having delivered medicine and other important supplies valued at more than $4 billion globally. From as far back as the 1970s and 1980s, we pioneered the practice of developing community health programs, including writing books and hosting workshops and seminars that strongly promote a community health approach. In the 1990s, MAP also created a model that engaged churches in Africa in programs that helped to combat HIV and AIDS. In so doing, we convinced the UN and other international agencies that local churches were effective grassroots organizations that could be mobilized to address public health issues. MAP has played a leading role in the eradication of a disease called guinea worm from the West African nation of Côte d'Ivoire. We have prompted the strengthening of laws in Bolivia to protect women and children from sexual abuse. As part of our strategy, we trained judges, lawyers, and law enforcement in ways to implement these new laws. MAP has provided effective and critical relief in response to major national and global disasters, from the Rwandan genocide to the Asian tsunami, Hurricane Katrina, the Haiti earthquake, and many more. And finally, we're recognized annually by Charity Navigator, Forbes magazine, and by other organizations as one of the top-rated charities in the nation. One of our biggest challenges has been, and continues to be, the significant changes taking place in the pharmaceutical industry. For more than 5 decades, we have relied on donations of quality medication and supplies from that industry to fuel our global distribution program. Over the past decade especially, that industry has gone through massive changes, including mergers and acquisitions. Also, heightened regulation has limited the availability of donations, and improved inventory practices have caused significant changes in reporting requirements. The industry has chosen to focus on expensive lifestyle drugs and drugs for chronic diseases that are not as relevant to developing World Health programs. The emergence of a strong generic drug industry with tighter margins and less philanthropic interest than the larger branded companies has also negatively impacted the availability of medical donations that MAP needs in order to provide, prevent, and promote healthy living. In order to continue building our global distribution of medicines, we've been forced to purchase low-cost medication that is available on the global market to help supplement what we cannot get in the U.S. pharmaceutical donations. This has forced many internal changes in the way we go about our work and the way we resource the organization. As part of our strategic plan, we have identified 3 priorities for additional resources, built around our provide, prevent, and promote strategy. They are first, to build our global pharmaceutical purchase program, including the establishment of a revolving purchase fund to ensure we have uninterrupted access to quality, long-dated, low-cost generic medication from the best global sources. This will allow us to get more essential medicine to the health programs we support around the world. Already, we have established a foreign trade zone at our Global Distribution Center in Georgia to allow for duty-free importation of international medicine that can be combined with the donated products we receive from U.S. companies. Together, this donated purchased model allows us to significantly expand our medical supply services even in the face of continued change within the U.S. pharmaceutical industry. We need additional funds to ramp up this program. Next, we have created exceptional models for combating neglected tropical diseases, delivering clean water projects, and improving the health of women and children. These programs are ready to be scaled up and expanded, but are delayed because we need larger, multi-year grants that would allow for appropriate planning, building up, implementing, evaluating, and reporting. Finally, we have tested and proved our MAP Village model of comprehensive community health development. These projects support a village as it develops its own vision for its future, crafts its own development plan, and implements activities in order to achieve their own goals. Each village project provides a great opportunity for corporations, foundations, churches, and families to sponsor a village, build relationships with the people there, and track their progress over several years. MAP could deliver health services in disaster settings alongside other organizations that provide other relief activities, such as working in refugee resettlement, shelter, and food security. We're already working toward this goal. We're doing this by cooperating in a global alliance of Christian agencies that are building plans to respond to major disasters together. This comprehensive program will be delivered by a response team that will more thoroughly help meet the practical needs of affected populations.